Well, Dr. Aziza Cisse is a GP with a focus on women's health and joins us now. Good morning to you. I think my first question to you is, why does it take so long for women to get that all-important diagnosis?
Yeah, such a great question. Thank you so much for having me. That VT was very emotive, wasn't it? And part of the issue is, first of all, women unfortunately never feel listened to. The call for evidence that the Department of Health released a couple of years ago showed that over 80% of 100,000 respondents felt like they weren't listened to by their healthcare professionals. There's a lot of dismissal, and we know for sure that medical misogyny exists. There was a report that came out just the end of last year. But endometriosis is quite a misunderstood condition, and also there's not much awareness about it, and not just in terms of the general public, but also in terms of healthcare professional. We don't have enough training, we don't have enough knowledge. So I wanted to take a minute, if that's okay, to talk a little bit about endometriosis. Would that be okay?
Of course it is. Yes, please.
Okay, so I brought this, John, you'll probably remember this prop from before, but basically it's an internal gynecological anatomy, and this is the womb. And basically we have the endometrial lining, or the womb lining, which thickens over the course of the month in response to the menstrual cycle hormones, and then it sheds and comes out through the vagina. Now, what happens in endometriosis is you have tissue that's similar to this lining, which does the same thing and responds in the same way in places outside of the womb. So that could be the ovaries, the fallopian tube, it could be the bladder, it could be the bowel. It could even go as far as the lungs. And unfortunately, because it responds in the same way, it thickens and then it has nowhere to go. So that causes scar tissue, inflammation, irritation. And depending on where it is, that's then what causes the symptoms. So if it's in the bladder, it can cause blood in the urine. It can cause blood in your stools if it's in the bowel. It can cause, if it's in the lungs, because it can go as far as the lungs, it can cause chest pain. It can cause coughing up blood, breathlessness. So it's not just a gynecological condition. So absolutely, it can cause heavy, painful periods, but it's a whole body inflammatory condition, which a lot of people don't realize and understand.
Is it because doctors might talk to a woman in their 10 minutes in the GP surgery and it could be confused for a whole host of other things?
Absolutely. So as I say, these conditions, there are so many different conditions that can mimic symptoms similar to endometriosis. So absolutely, as a GP, you come in and you have your hat on and it could be anything and everything. So this is where we always encourage women to please track your symptoms, okay? And then tell us everything that's been going on. And also, if you suspect that it might be endometriosis, we encourage you, mention it, so it comes into our head like, oh, okay, actually, yeah, let's consider that as an option as well. And it's the fact that, as I say, it takes, according to Endometriosis UK, it says that it takes up to 9 years for a diagnosis to be made. But I think majority of that can be reduced if we just listen to women and if we don't dismiss symptoms such as heavy, painful periods as just a period. I'm also an ambassador for well-being of women, and we released a campaign a couple of years ago called Just a Period, so we can obliterate that terminology, because we have dismissed and gaslit women for too long and said that, this is just a normal plight of being a woman, unfortunately. So yeah, education, lack of awareness about symptoms, and also just listening to women when they say they're in pain and they're struggling.
And I'm assuming that the sooner it is diagnosed, the sooner you can begin treatment and can manage and control pain.
Absolutely. And this is why it is so key that we get the diagnosis early. So in endometriosis, what can happen, unfortunately, is complications. You can have the buildup of scar tissues, which can cause severe damage, and it can lead to immense and extensive surgical procedures to try and treat that. And what we need to do is treat it early, sort of keep it at bay to prevent it from progressing. But here's the deal. There is still no cure for endometriosis. And this is because, unfortunately, we don't understand why it happens. And unfortunately, it's because there's not enough research in women's health. It's like 1% to 2% if we remove cancer in terms of funding for research. So we don't know what's causing it. We don't have a cure. We only have treatment options which sort of keep it at bay. And the gold standard treatment of endometriosis is taking it out, usually through laparoscopic surgery. So that's where they put a keyhole. It's keyhole surgery where they put scopes into the tummy, have a look, and if they find the tissue, they remove it. But that doesn't stop it from coming back. You understand what I'm saying? So until we get a definitive cure, women will continue to suffer.
Dr. Aziza Cisse, thank you so much for explaining that so brilliantly this morning. Great to talk to you. Thank you.
Thank you.
It's